Hello, Miss. Today I am performing for the rotation return demonstration number 4, in which to have the assessment with ear, nose, the mouth, and also the sinus with my patient. And the first thing to do, I already prepare with my equipment. The rationale with that is to organize and facilitate those equipment being needed. It also asks the patient the identification and condition. Sir, wa ba kayo nabating sakit, sir, sa imong dunggan?
Wala.
Okay, and also, explain to the patient the process of procedure. Karon, sir, ato aning i-examine imong dunggan, imong ilong, imong baba, sir.
Okay.
Okay. The rationale with that is to confirm necessary providing information, past test, um, past test the cooperation and understanding. It also, I'm already wash my hand for me to prevent spreading virus and bacteria. It also, I already closed the door and the window to privacy with my patient. So first and now, first thing for the checklist is to examine the ear of my patient. Okay, since my patient already sat down, so I may now having um, first inspection to occlude the tragus and try to say a word that contain three syllable. Okay, and I may now to occlude the left, or this is the left, then I go to try to see this side. Mm-hmm.
Hospital.
Okay, and try other one. Mm-hmm.
Hospital.
Okay, so um, when I test the hearing with my patient was very normal. And now, having the waiver test, and this is considered as, assume this as the tuning fork. And now I am having with the waiver test. Okay. Don't sir. Okay. Then the next was the Rene test. Don't sir. Okay. So was very normal because when I um because for the Rene test, it's high to hear with my patient the ear conductive than the bone conductive. How about karon, sir? Nagyapon kay nadunggan, sir? Wala na. Napa wala na.
Na.
Wala. Unsa man naman nadunggan, sir? Wala. Wala na siguro, sir. Okay. Wala na. So, the next one is to palpate the ear tenderness. Okay. Okay, was normal. And now, let us also inspect the ear of the patient and assume that this is the otoscope. And at this time, this otoscope is placed to the tragus. Wait. Tragus of the patient. Okay, this one. To inspect the canal of cerumen, the inflammation, and the swelling, foreign body, and other lesion. Okay. Okay. When I having the palpation, inspection with the ear of my patient with the inflammation, swelling, and our other lesion was very normal on my
Sinugo.
and now let's go for the examine the nose of my patient. So the first thing to do is to tip the clients to head back. Okay, Anna, sir. And use your dominant hand to position the hand and hold the light. Okay. Okay, was normal. So I have this one. Okay. And now, let's us also inspect the lining nears and observe the present redness, swelling, growth, and discharge the nose of my patient. Okay, sir. Ato lang, sir. Okay. Everything was normal with my patient. Um, and now, let us inspect the nasal septum and also inspection with the mucous membrane for purulent drainage, and nasal polyps. Okay, so using the pen light. Okay, sir. Okay, everything was normal with my patient. And now let's also palpate the cynosus with my patient, in which the frontal maxilla, ethmoid, and sphenoid sinuses. Okay, this is the frontal. Okay, the ethmoid, the sphenoid, and the maxillary sinuses. Okay, everything was normal with my patient. And then next is to examine the mouth. First thing to do is to examine the lips. Okay, so must lips have the see inspection the color, the textures, and also the contour of the lips. Okay. Okay, was normal. And now let's go for the second one, the inner and vocal mucosa. Okay, use the tongue depressor and also the pen light to see the vocal mucosa and try to inspect the moisture, the color, the textures, and try to see if there is the presence of lesion like ulceration and abrasion. Sir. Sorry. Um, okay. Everything was normal with my patient. And this time, let us examine the teeth and gums with my patient. So, using the pen light, so first thing to do is to examine the gums. Okay. At this time, the gums, let us inspect if there is any bleeding, the color of the gums of my patient, and also the retraction and um, edema and lesion. Okay, sir, nga sir. Ano, sir? Ano? Okay, was normal, and now let's also examine the teeth. Examine the color of the teeth, the presence of piling, and the dental caries. Okay, the when I examined the teeth was very normal, and also the gums. And now the next is the tongue and the floor of the mouth. So at this time, let us inspection the color, the moisture, the textures, the position, the mobility, and any coating floor of the mouth of my patient. Also the tongue. Okay, sir, say ah.
Ah.
Okay. Uh, When I checked, the tongue and floor of the mouth was very normal. Now, let's go for the palates and the ovula of my patient. So, sir. So at this time, let us check the palates, the size, the color, the textures, and the presence of bony prominence. Okay, nga nga sir. Okay, was very normal. And now let's go for the oropharynx. At this time, let us inspect the palatine arc. And the next was to inspect the tonsil, the color, discharge, and the size. Mga sir. Sila ko, sir. Ah, say ah.
Ah.
Okay, so everything was normal with my patient. So, I'm done with examining the ear, nose, mouth, and the sinus of my patient. So before that, I need to keep those equipment that I am using and have to disinfect. And get the report form to put my any examination test with my patient to document those when I examine with my patient. So assume that I'm done. Okay, so keep it. And that's all about the assessment with ear, nose, mouth, and the sinuses. Sinus. So thank you and good day.
Say